Hello, everybody, and welcome to the next RetireAdvisers Podcast. We're so delighted to have you joining us today. My name is Zach Allen. I'm the CEO here of Pension Consultants, and I am joined by Michaela. Michaela, what's your title here?
I am the RetireAdvisers Manager.
Perfect. Awesome. We've got some fun topics to go through today. We are going to be covering Social Security. We'll touch on Medicare a little bit, and we'll go through a lot of the major questions that participants that we engage with, as well as some of our clients, some of the big things that we've heard from individuals over the years. So I think this will be helpful. This will be exciting. If you're nearing retirement, or if you're just kind of curious, this will be a valuable resource for you. Michaela, when it comes to Social Security, what are some of those big questions that participants are asking you and the team when it comes to Social Security?
Yeah, the biggest one is, when should I take it? And the second I get most often is it going to be around?
Right. So those will be some of the big questions we can try to answer here. Boy, the will it be around, that seems like a bit of a can of worms. So maybe we should start a little simpler, a little more kind of down to the core of financial planning and some of the, more traditional approaches for thinking about Social Security. So let's start there. When should I take from Social Security? I think there might be some slight differences of perspective and some different thoughts here. So this will be good. People will get two different takes. Why don't you start? When should one take from Social Security? Obviously, you're eligible at 62 and you're later at 70. What's the advantage of waiting? Why not just take it right away?
Right. So you are correct. You can take Social Security as early as 62, as late as 70, and every year that you wait, the benefit increases about 8% for most people. At 67 is when you get the full retirement benefit. And so when it comes to the decision making, I like to think about, when do you have enough to be able to have the retirement that you want? And also, what is your goal? So if you can retire at 63, and yes, you might not get as much in Social Security, but you're able to enjoy your retirement at the amount of that benefit, then I don't think that's a bad thing. If your goal, though, is to get more money out of Social Security, then I think you would wait. But I know that you feel strongly about delaying Social Security.
Well, no, I'll help us both out a little bit, because I think there's two focuses, two emphases, two objectives you can have in retirement. One is purely financial.
That's right.
What does if we're just simply, I want to have the most money and maximize the financial, to me, it's pretty clear. Now, there's another kind of emotional consideration, a personal preference. And what happens is, if you don't have just a ton of money and you delay Social Security, we've ran the income needs analyses, and you meet with people and you say, well, if we took it 62 versus 70, you'll get more money out of Social Security, assuming you live until, into your 80s. But you might draw down your account balance in those first couple of years of retirement before Social Security kicks in. So in my mind, and maybe, correct me if I'm thinking about this maybe differently than your perspective, that watching that account balance potentially draw down over the first, 3-4 years or more of retirement before Social Security kicks in and your account balance starts to grow from there, because that you've got to finance all of that extra money during that time period. So is that your perspective on that? Am I missing something different there?
Okay, so I want to ask more questions, because I want to make sure that I know what you're saying. So are you saying, like, if an individual wanted to retire but not take out Social Security and take it out later, that they would have to finance? That's what it sounds like you're saying, but I'm assuming that's not what you were saying.
No, that's right. Yeah, because if you take out, let's say you've got, just to make the math easy, you've got $1 million, and if you're 62 and you could take Social Security right away, well, your account balance might be flat, throughout retirement. But if you wait till 70, you're really going to draw down that balance over the first couple of years.
Oh,
And
absolutely.
then you won't hardly need to withdraw from it at all because Social Security will cover so much more of what you need by the time you hit 70. So I imagine for people that are in that second camp, that would be a tough thing to watch your balance grow. Even though you know it will work out in the end, just psychologically it'd be challenging. So is that part of the reason for maybe why not to, or why some people might choose to not delay and wait all the
Right.
way until age 70?
I think 100% that would put a play into it because no one wants to see their account drop. Like everything else with finances, it's really going to it's going to be about the individual and what their goals are and what they're able to withstand. I'm actually really talking about people that might not have tons and tons of retirement, but enough to get them by and taking Social Security um, out before 67, but still being able to retire when they want and have the expenses, paid for expenses at that age. So
I see. So maybe you really just,
people want to retire.
yeah, and if you're, really close to the line in terms of can you afford retirement. So part of your argument is, well, let's go ahead and build that cushion in just right away, with that extra Social Security income, so that way we're less dependent upon the savings that we have. Is that kind of my understanding, right?
Yeah. I don't know about right there because you might want to, maybe delay retirement a little bit in general if you're that close. But yeah, yeah. And I think again it's going to come to the goals of whoever's taking on the Social Security. Is it to retire at this age or is it to get as much as possible from Social Security?
Sure.
But yeah, I think that's very, very interesting.
Well, this is where I feel like every episode is an opportunity to pitch some of our tools and resources that we have. But when you sit down and you're trying to plan out, spending in retirement and that first decade or two or three of retirement, what that looks like, you want to model out, well, what if I take here? What if I wait until 67? What if I wait till 70? What happens to my account balance? Do I have enough funds to finance all of that? So all of this is very hypothetical until you sit down and run the numbers and take a look at it. But what we see often is in terms of what balance do you have at age 90, 95, it's usually higher, not in all cases, but in most cases, if you wait until later to withdraw, because that 8% increase in Social Security each year by delaying that's such a huge benefit that you lock in for all of retirement.
I agree with you. But okay, I think when we look at the math, right, you would have to live after 70, correct, for you to really make more money by delaying, right? There's kind of that,
Right, yeah. So
right?
I know that chart that you're mentioning.
And
So
I think it's
it's
70.
it's around 80.
Oh, is it 80?
Yeah, so around 80, that's where, so in the idea for the folks at home, if you're 62 and you don't make it until 65. So obviously you would have withdrawn Social Security for 3 years, you would have gotten some money, but if you would have delayed until 70, you would have never gotten anything at all. So
Right.
so this is part of the argument for, we'll go ahead and take it sooner, because if you pass away at a younger age, you will have made more from Social Security than you would have otherwise.
Right. And I will even say, too, if you're saying 80 is the age, what's the life expectancy of most people? I think it's
85, but it probably for
85.
maybe for
I'm thinking lower 80s.
I think if
okay.
you're younger, right? If you're younger, you're working age, it's probably closer to 85. Women in general probably are more there than men are probably
Right.
closer to 80.
So if you're a man, take it out earlier. If you're, no, I'm just kidding.
Yeah, I don't know if we want to necessarily design anything around that. But my take on that argument is, well, you're not around to regret your decision.
Yeah, that's true.
And so what's the one circumstance we cannot afford? It's running out of money while I'm still here. If I could have made more money, but I'm no longer here, I'm not there to say, whoops.
Right.
the main thing, and what I try to optimize whenever I'm working with people, is that one instance of what happens if we make a mistake and we just simply run out of money before, sometime in our retirement. And so, again, seems a little clearer to me. Depending on, it helps to have some cushion in your savings, so you've got a nice healthy balance.
Right.
But delaying, if you run out of money, it's usually not in your 60s. It's usually in your 80s, or if you live into your 90s. And so, all of that extra income from Social Security by waiting until you're 70 is some pretty good insurance against that happening to you. Even if it may be suboptimal, if if you only live until you're 70s or
Right.
something.
And it comes back to again, that's pushing the income needs analysis. Is what are your goals and what amount of Social Security do you need to meet your goals? Do you know what I'm saying? And I don't think that delay is the answer, but I do think it could be for some people. And
Sure.
Look at your individual financial picture and your goals.
No, you're right. So I'm approaching this from a robot calculator perspective. And this is what I say when I'm talking to real people is, I know you're not going to follow this advice because nobody ever does, but you should wait to take Social Security because nobody. I mean, I really don't know if I can think of a single person that we've worked with that actually waited until age 70 to take from Social Security. It's always like, I'm just a phone call away from like a few grand per month coming into my bank account, and that's a hard proposition to ignore. So I often add that disclaimer: nobody actually follows this advice. Nobody actually does this. It's okay if you don't. If you're 62 and you're like, I'm retired, and you know what? Even if I'm suboptimally in some slightly worse position 20 years from now, I kind of just want that paycheck coming in. Right. So I think that's also part of what you're saying too. That's kind of more of the practical reality.
Yeah, the reality of it. Yeah, because people want to retire and they want to enjoy themselves, or I hope they do.
Right. Yeah, and I think for most people, even just a couple $100 extra coming in is like a really big deal. And so, if you've paid into Social Security your whole career, that's a pretty decent check coming in. So
that's right.
Okay, well, great. I think we covered that. You got a lot of different perspectives as far as what the options are and what the trade-offs are. You talked about will Social Security be around? Before we wade too far into that, I think it would be interesting to talk about, just maybe make a point or two about spousal benefits.
Go ahead. I feel like you're in the know on that.
Okay, I'll keep rambling. So spousal benefits. Just a quick tip. Social Security is complicated. There's all sorts of different strategies for filing. So you don't. I don't attempt to memorize all those different strategies. I don't think you should either. There are online tools. You can plug in some information about yourself, some free calculators. I think Open Social Security is what it's called. There's a few other resources. You just plug in your information, you plug in your spouse's information, and it will say, again, very calculator-like, here's the optimal strategy for who should claim first, and when to claim, and is there any opportunity for spousal benefits. But the one reason I bring up spousal benefits, because I think this is the one thing that people may not understand and appreciate much. If there's a lot of disparity in income from one spouse to the other throughout the working career, what's likely to happen is one spouse is going to get a nice big monthly check from Social Security, and the other spouse may not very much at all. If the spouse that is getting the smaller check is 50% or less of the spouse with the bigger check, you can probably benefit more by the second spouse, the spouse with a smaller check, claiming spousal benefits on the other spouse. And what the Social Security Administration allows for is claiming spousal benefits for one spouse that hasn't paid into Social Security, and that's one way to really maximize. I mean, that's a big deal for often when there's this big disparity where one spouse was the breadwinner. You might look at a $3,000 or $4,000 Social Security check, and that could be an extra 1.5, 2,000 on top of it for the spouse as well. So that's a huge difference. And I think for in fact, I just yesterday was talking with somebody, that covers a huge chunk of living expenses in retirement. So you ever get any questions about that?
I do get a few questions, and we always say, talk with the Social Security Administration, because the reps help to determine a good strategy for you. And I do believe, right, to qualify, you need to be married for 10 years. Is that right?
I think you're probably right. Yeah.
Okay.
Yeah.
Yeah.
Yeah. I can't just go to Vegas and. No. Yeah. Yeah. There are stipulations around it. Again, there's just so many rules to keep up with, but that's the one I think I've seen a lot of people not be aware of or not think about. There's also some other rules in terms of and this has changed recently. Like there was one couple I was working with that were retiring. I want to say it was maybe just a year or two ago, but like a month before retiring, they allowed teachers to claim spouse or Social Security benefits.
Yes, yeah.
And that was a big deal.
Yes.
And so there were carve outs where, well, if you didn't have Social Security deducted from your paycheck because you had a teacher's pension or something like that, you weren't eligible for it. So it's worth looking into if you did not have a normal kind of W-4, all the normal tax withholdings type income. It's worth looking into. There may be some carve outs where you can actually claim now.
Yeah, I forgot about that. That's really cool that now educators can get Social Security. Yeah.
Right. Yeah. So it's it's honestly I wouldn't say it's quite as important as making sure your money's invested properly, because if you don't do that, that's really bad. But maybe the second most important thing in terms of making sure your money is set up to work for you is going to be, working through the details on some of the Social Security benefits, when to claim, utilizing some of these other factors, because it can really be the difference between, very comfortable and
Right.
And not potentially.
Right. I think last time we looked, about 40% of expenses, right, in retirement are paid by Social Security for majority of people. And obviously that would vary to person, but you can get most of your expenses paid for just by utilizing Social Security in a smart way. So
Right.
yeah, it's key.
Right. Yeah, absolutely. One just quick item. As you get closer to retirement age, Social Security Administration starts sending out information on estimated benefits. So that's a pretty helpful, useful research resource to watch out for. If you haven't got that, or you're not sure if you've gotten it or whatever, you can always go to myssa.gov and create an account. I've actually done this just because I was curious, what the process was like. It's pretty easy. You put in, just some basic information about yourself. You get a login created, and it'll show you your whole earnings history for, each year, what you've paid in. I don't know if it'll show you exactly what you paid in, but long story short, that will give you a very accurate estimate of what you'll be eligible for at certain ages, because a lot of the online calculators make some assumptions of, you make this amount today, so you probably made this much last year and the year before.
Right.
And so those calculators, even the one on the just the quick calculator on the Social Security Administration's website, if you have not had the normal, 3% annual wage increase or whatever it is each year,
Right.
that number could be wildly off. So going in and creating an account is probably the best way to get a pretty accurate estimate of what you're likely to receive. And obviously what you might make next year or the year after that, all that's, we don't actually know. But it's a good resource that I think a lot of people don't think about.
That's good. It's good.
Okay, so should we try the big scary topic?
I think we should.
Will Social Security still be around? How I have I have heard this uh, question a lot. I imagine you have as well.
Hmm.
It's something people bring up. How worried should one be that Social Security just simply will not be there when they approach retirement?
So let me say this. I think you are very optimistic on a lot of things, and I'm like not. I don't think that people need to be worried that it won't be there in any sense. Like, if hey, I'm gonna get $0 from Social Security, but I do think there is a legitimate concern that you're not going to get your full benefit. And the more I looked into it, that is a legitimate concern. I think they're estimating in their 7 years that the trust would be depleted, so they wouldn't be able to provide 100% benefit. If we
Right.
keep things as is, I think the argument against that is, well, Congress will act. Um,
Right. No, that's great. I do appreciate that you pointed out like worst like doomsday scenario for this is a fraction of the benefit, not Social Security will go away. So that's because people are still paying into Social Security. So the problem is, and this is kind of a problem with the whole system, is the what gets paid into Social Security immediately gets paid out to to the beneficiaries, right, or the
right.
who's actively claiming. And so there's there's been times where that cohort of paying into was more than sufficient to cover the payouts, but now it's flipped where there's not enough paying in, so there's a gap, right, each month or whatever.
People don't have babies anymore. I mean, but
Right, right.
seriously, that is playing a part into the.
Yeah, that's a whole yeah, I would that's a really interesting topic for like what the next 50 years look like or something, just the
Hmm.
um what do they call it? It's like the replacement rate, I think,
Yeah.
and all the impacts that's going to have on a lot of the social programs. But but I'm glad you brought up the fact that it's really you don't have to worry about it going away. I mean, that's just not even possible. So
Right.
just like you show up to Social Security Administration, they're just like, nope, sorry, it's gone. Well, what the stats that get pointed out is, hey, there is a little bit of money within this trust, and that is likely to be depleted based on the current rates, early 2030s.
That's right.
So this has happened um, before, right? There have been moments in history in the past. I believe the 80s was the last like kind of major scare with this, where people go, oh my goodness, we're running out of money, and what do we do about it? And so what has been done in the past is you make some of those adjustments to the to when you can claim for Social Security, pushing it from 60 to 162, as well as some of the other kind of long-term benefit assumptions. And at the time, it impacted individuals who were like 21 years old at the time. So again, if we're just using history as the guide, it's what has been done in the past was more to deal with um, younger people when they retire and adjusting their benefit, as opposed to I'm retiring next year and there was just a law passed that says I no longer can claim.
Right.
And
Right.
so most of the people we talk to, although young people also have a fairly pessimistic take on Social Security as well, which by the way, what's the answer? Save more.
Ah, yeah, of course. That's the one thing you can
That's
do.
the only thing you can do, right? But if you're like 5 or 10 years out from retirement, I just personally don't think it's something you really need to practically worry about, because it's just that's that's you are in the voter cohort that is the most reliable voter cohort, of them all, and politicians are going to be pretty eager to not make you mad about this topic.
Right.
Is That's my take. But anything I said you disagree with?
I absolutely agree with that. Yeah, I think there is definitely an incentive to make sure that it is funded 100%. But I do think politically it's a very interesting time too. So,
Yeah,
but yeah, I think you're right. I don't think you need to worry too much for anyone that's currently receiving Social Security.
sure, sure.
But they do say if you do not act, or if there's not, I was looking it up. They said that people now in their 50s could see a reduction in, but
Sure.
again, they're more than likely going to act. So.
Sure. Yeah. Yeah. Cool. Well, good thoughts, perspectives there. Um, what else? I mentioned at the beginning we could touch briefly on Medicare. That's a topic that, if you're nearing retirement, you're likely to have. How should people think about Medicare? Do you want to give kind of just the high level architecture of what that looks like?
Yeah, so when you turn 65, you can and you should apply for Medicare, especially if you plan on retiring 3 months before or 3 months after 65. And you're really going to have two options. You're going to have the original Medicare, and then you're going to have the second option of Medicare Advantage. Uh, Medicare Original is more comprehensive. It's going to cover, everything, hospital stays, um, medication if you're doing Part D. It's like I said, it's more comprehensive, but it's more expensive than Medicare Advantage, which is kind of pieces of Medicare Original that you can kind of build. So it's cheaper, but it's not as comprehensive. So depending on what you think your physical needs are, you might want to look at family history, and if you plan on traveling, you should factor in which is a better option for you.
Perfect. Yeah, I will, I'll gladly state that I'm not the expert when it comes to Medicare. That's it's an insurance product. There are people out there that just have more expertise than I do. My perspective and my assumption is most people are probably just going to go with Medicare Original, and that's going to give most people what they need for the most, in the most cost effective way. And then, but if you're one of these people that needs a little more customization, needs, things covered that aren't part of original Medicare, then that's where you can start to look to Part D and to Medicare Advantage to kind of give you a little more, a little more of that customization.
Mm-hmm.
So that's what it appears to me. But the one thing I know is don't miss enrolling in Medicare.
Right.
Don't do that. But as we were talking about before, right? If you enroll in Social Security, you automatically enroll into Medicare, and so as long as if you're taking before age 65, then you're good, right?
Right. And if you're currently working, most of the time you're not going to get penalized for not
That's a good
enrolling
point.
in Medicare. But definitely look into it because it could help some of your premiums with your employer's insurance.
Yeah, no, that's a very good point. With if you're past 65, and there are some stipulations around the type of employer healthcare plan.
That's right.
So it's not just any and all I'm employed, but I think for most, pretty much all employers over, like, I don't know, 10 or 100 employees or something. So it's most employers, but something to look into. If you're covered by that employer healthcare plan,
That's right.
you're exempt from the age 65 requirement. But again, something you want to look into, something you want to ask your HR staff about,
Right.
because if you make a mistake there, that can be costly.
100% agree.
Yeah, but that's a good point. That has come up a bit in the past. Well, this has been pretty good, Michaela. What else? Any other thoughts or anything else that we need to talk about as it relates to Social Security and Medicare before wrapping up here?
No, I think always check with the experts. So you want to chat with Social Security. You want to chat with a Medicare rep to make sure you're getting the best information.
Yeah, absolutely. Well, great. Well, thank you, Michaela. Appreciate the perspectives and insight. This has been a fun episode. Of course, as always, I'll pitch what we've got. If you have questions and you want to sit down and talk with somebody, build that broader financial plan, and map out maybe hey, what happens if I take Social Security at this age or this age. We can start that conversation and help you wrap your head around it. So, but any questions or any needs, reach out to us, reach out to Michaela's team, and we'd be delighted to help you. But thank you for joining us today, and we'll see you next time.